My name is Webb Smith. I'm a senior exercise specialist at St. Jude. I've been here 5 years. I ended up at St. Jude after I finished my master's degree. I felt like that wasn't something I could pass up. I grew up in Memphis. So when that job offer comes along, it's kind of hard to turn down. I'm not sure how I would have told my parents I'd turn down a job opportunity from St. Jude. My primary job is to maintain the day-to-day operations in the Human Performance Lab and assess physical function in childhood cancer survivors.
You're going to reach forward and try to push this as far as you can, okay? So go ahead.
Childhood cancer survivors, they receive cancer treatment and then they go on and interact in their normal life, and we bring them back multiple years later and see how they're functioning, how able they are to complete activities that you or I would encounter in daily life, and see if they have any difficulty, where they lie, what things are challenging. We measure things as simple as height, weight, body composition. We'll look at their flexibility, their strength.
Good. As hard as you can go. Squeeze, 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 squeeze.
Their balance, how easily they're able to complete tasks that require a little bit of exertion, like walking. So we test a lot of those things to evaluate what they're doing, and we can compare that back to what we would anticipate from someone their age and gender. The Human Performance Lab here at St. Jude, we have some really interesting technology that allows us to test those. We do a stress test, what you would get if you were having heart trouble at the doctor. We use a treadmill or a bike or even an arm ergometer so you can cycle with your hands. We do gas collection, so collect all the air that you breathe out, measure what the ratios of the gases are, and that really tells us how well your heart, lungs, and blood vessels function. We also do strength testing.
Pull. Good. You can relax.
Those end up being really useful because we can then take those and think of them in more functional terms, like standing from a chair, or walking, or jumping, jogging, those sort of things. We also do balance assessment.
It's going to tilt forward. If you lean back, it's going to tilt back. Okay?
And we track your center of gravity, which is where the weight lies between your feet. And we can measure how much that moves as you stand and how well you can correct for it.
Okay. I got you.
That allows us to really estimate how well your balance is working and how well each of the systems that help you balance are working. We also do some more specific things related to their cancer therapy. We would evaluate how well their sensation in their hands and feet work. Some of the chemotherapy agents can affect those things and give them long-term problems. I think that St. Jude Life is a great thing. It's a groundbreaking study that is providing data that is, in a lot of ways, the envy of the scientific community, because it is a massive amount of data that answers any of a number of questions and provides such a great resource for the hospital as well as cancer survivor research. My wife is a nurse here. She's been here about 2 years. She works on the solid tumor floor. We have 2 small boys. We have a 3.5-year-old Carter and a 7-month-old Cohen. It's been a really interesting adventure with them. When we had our first son, we found out shortly into the pregnancy that he had spina bifida. Now he's 3.5, and he uses a walker to get around. Gets around really good. He's totally full of energy, completely fearless. He's a joy to have. I often tell people that being a parent to a special needs child, it's been one of the most challenging things I've ever done in my life, but at the same time it's the single most rewarding experience in my life. I definitely think that being a parent has changed the way that I think about and approach my job and the families and the kids that I interact with. That's certainly helped me, being on the other side of the medical setting, provide information and support that I wouldn't have before. Experiencing the medical community from the parents' point of view, it's certainly a different perspective. I see my role in the type of work and the research that we do in the Human Performance Lab as really helping these people live a normal life so that day-to-day life isn't max effort. At the end of the day, you can think about tomorrow, not recovering from today kind of thing.